Welcome to the deep dive.
Great to be here.
Today we're plunging into hyperbaric oxygen therapy, HBO.
Right.
We've got some really compelling research looking at how this treatment, basically breathing pure oxygen under pressure, can be, well, a powerful ally against infections.
It's a fascinating area.
So our mission today, to really get under the hood, understand how boosting oxygen like this affects our own defenses and the microbes, going beyond just, the basics.
Exactly.
We all know oxygen is vital, but under pressure. That's where it gets really interesting, doesn't it?
It really does. That increase in pressure is the absolute key. It lets us dissolve way more oxygen into the blood.
More than just breathing it normally.
Oh, significantly more. And this super-oxygenated environment, well, it can have profound effects, both on our immune system and sometimes directly on the bugs themselves.
Okay, so let's unpack that first part. Our body's defenses. The sources talk about phagocytic leukocytes, our first line of defense.
That's right. Think of them as the body's little vacuum cleaners. They engulf and digest invaders like bacteria.
Okay.
And they have this two-phase attack. First, they release some antimicrobial stuff, degranulation it's called.
Right.
But the second phase, the oxidative phase, that's where oxygen comes in big time. They generate these highly reactive molecules, free radicals like superoxide.
And those are toxic to bacteria.
Extremely toxic. So the core idea here is oxygen isn't just fuel for us. It's like ammunition for these specific immune cells.
So they're literally weaponizing oxygen.
In a sense, yes. And the effectiveness, how fast they produce these toxic molecules and kill bacteria, is directly linked to the oxygen levels right there in the tissue.
Makes sense.
If those levels drop too low, the sources say below about 30 mmHg, the killing power of these cells just plummets.
Okay, so low oxygen or hypoxia really handcuffs our immune cells.
Precisely. Think of it like Pac-Man running out of power pellets when the oxygen dips below 30 mmHg. And that's where boosting oxygen with HBO starts to look really attractive.
Fascinating. Okay, so besides boosting our own defenders, can this supercharged oxygen act like an antibiotic itself, directly hitting the microbes?
Yeah, that's a critical question.
Yeah.
And the answer is yes, especially for certain types. Anaerobic infections are the classic example.
Those are the ones that hate oxygen, right? Like gas gangrene.
Exactly. They thrive where there's little or no oxygen. So flooding their environment with high-pressure oxygen via HBO, it's basically poisonous to them.
Like throwing them into their worst nightmare, as you said.
Pretty much. Yeah.
Okay, that makes sense. But what about the aerobic bacteria, the ones that need oxygen? How does HBO affect them?
Ah, that's more complex. They often show what's called a biphasic response.
Biphasic, meaning two phases.
Correct.
Well-
At slightly elevated pressure, say, between 0.6 and 1.3 atmospheres, or ATA, their growth can actually speed up a bit.
Oh, that's not good.
Not ideal, no. But if you push the pressure higher, above 1.3 ATA, then you start to see their growth inhibited. It becomes toxic even to them.
So the dose of oxygen, the pressure, is crucial.
Absolutely critical. Too little might actually help the enemy, but get it right and it's harmful. And importantly, it's also time dependent. They need to be exposed long enough for the damage to occur.
Right, so it's this really delicate balance. We need enough high-pressure oxygen for long enough to hurt the microbes,
Allowing our own immune system to win.
but without harming our own healthy tissues in the process.
Exactly. So there are basically two main goals with HBO for infections. One,
Yeah.
directly hit the microbes hard enough with oxygen toxicity.
Okay.
Two, just raise tissue oxygen enough to really supercharge our immune cells, maybe without reaching levels that directly kill the microbes, but enough to tip the balance.
And the sources give examples, right? Like with TB.
Yes, Mycobacterium tuberculosis. Research showed its growth was significantly retarded under specific HBO regimens, like 2.87 ATA for 3 hours, twice a day for 5 days.
That's specific.
Yeah, and interestingly, less intense regimens didn't work nearly as well. Really highlights that dose matters.
That's quite something. And does HBO play well with antibiotics? Can it boost them?
It definitely can. There's good evidence for synergy, especially with certain drugs like sulfonamides.
Synergy meaning they work better together than alone.
Precisely. That same 2.87 ATA pressure was shown to make sulfonamides 5 to 10 times more effective against some bacteria.
Wow.
And what's really encouraging is this synergy was even seen against drug-resistant TB strains. That's a huge potential benefit.
So it could help tackle antibiotic resistance by making older drugs work better again in some cases.
That's the hope. It's like giving those antibiotics a power-up in the right situation.
That's a great way to put it.
And animal studies back this up too. Improving tissue oxygen can reduce infection damage, sometimes as well as preventative antibiotics. And combining HBO with antibiotics in models like peritonitis often leads to better survival than either one alone.
That really paints an encouraging picture. How exactly does HBO help antibiotics work better? What's the mechanism there?
Well, there are a few ways. Some antibiotics, the bactericidal ones like ciprofloxacin, actually need the bacteria to be actively respiring, using oxygen to work properly.
Right.
In low oxygen spots, bacteria can sort of go dormant, becoming tolerant to the drug.
Hmm.
HBO re-oxygenates those areas, wakes the bacteria up metabolically, and makes them vulnerable again.
Ah, I see.
We see this as potentially really important for things like Pseudomonas biofilms in the lungs of cystic fibrosis patients, where oxygen is chronically low. It gets around that tolerance issue.
And what about the really tough bugs like MRSA? Any hope there?
There's definitely promising preclinical work. Studies in rats with MRSA mediastinitis, that's a nasty chest infection, post-surgery showed combining HBO with drugs like vancomycin and tigecycline works significantly better.
So maybe fewer complex drug cocktails needed sometime.
That's the potential, yes. Using HBO to make standard drugs more effective against these resistant strains.
This is all sounding very positive, but the sources also caution it's not a magic bullet, right? Like with diabetic foot infections.
Absolutely right to bring that up. A big review of treatments for diabetic foot infections actually found surprisingly limited high-quality evidence for which specific antibiotic regimens work best.
Really? That's surprising.
It is. And it just highlights the urgent need for better approaches. And that's exactly where HBO could fit in as a valuable adjunct, especially since those feet often have terrible blood flow and really low tissue oxygen.
Okay, so let's zoom in on some specific infections. Why is HBO better than just giving someone, say, 100% oxygen to breathe through a mask?
It comes down to delivery. Normal baric oxygen, breathing it at normal pressure, just can't dissolve enough extra oxygen into the blood plasma to make a big difference in really compromised tissues.
Because the blood flow is bad.
Exactly. Swelling, damaged vessels, underlying vascular disease, it limits how much oxygen gets carried by hemoglobin. But HBO, by increasing the pressure, forces much more oxygen to dissolve directly into the plasma.
Ah, bypassing the red blood cell limit.
Essentially, yes. And that supersaturated plasma can then travel further into those hypoxic, poorly perfused areas where the infection is really dug in. Think of it like a high-pressure hose reaching further than a regular garden hose.
Okay, that makes sense.
Yeah.
And what's the typical HBO prescription for infections?
Generally, the sources point towards 100% oxygen at 2.5 ATA.
2.5 times normal atmospheric pressure?
Correct. Usually for about an hour per session, maybe once or twice a day, until things clearly improve.
And why 2.5 ATA specifically?
It seems to be a good sweet spot. It's considered safe for most patients, even quite sick ones needing multiple treatments. And it also appears to be a pressure that gives a good boost to the immune system function we talked about.
And these are short sessions, not continuous.
Definitely intermittent. Continuous high oxygen can actually be detrimental to those immune cells based on animal studies.
Right.
And always, always remember, HBO is an adjunct. It works with antibiotics and surgery, not instead of them. You can't just oxygenate away the need for the basics.
Got it. Adjunct therapy. Now, are there downsides? Times when you need to be cautious?
For sure. We mentioned that using pressures below that 1.3 ATA threshold could actually promote aerobic bacterial growth.
Because you're giving them more oxygen, but not enough to be toxic.
Exactly. So the pressure has to be right. Also, some microbes are clever. They have their own antioxidant defenses to fight off those free radicals our cells make.
Ah.
And believe it or not, some bacteria, like Clostridium, even produce free radicals themselves to damage our cells. So it's not always straightforward. The specific bug matters.
So it depends on the infection, and the pressure needs careful thought.
Precisely. Though interestingly, there's some research suggesting that maybe at slightly lower hyperoxygenation levels, like 2 to 3 ATA, HBO might help in systemic infections, septicemia, possibly by counteracting tissue damage from lipid peroxidation. Still needs more research, though.
Okay. So where is HBO actually recommended right now? What infections have the green light from groups like the Undersea and Hyperbaric Medicine Society?
They recognize several key conditions where HBO is a valuable adjunct. These are often the really severe ones. Necrotizing fasciitis.
The flesh-eating disease?
Right. Gas gangrene, chronic refractory osteomyelitis, bone infections that just won't heal.
Including that nasty ear infection, malignant otitis externa?
Yes, that's included. Also mucormycosis, a devastating fungal infection. certain brain abscesses, and infected diabetic foot ulcers that haven't responded to anything else.
And in all these cases, it's used with antibiotics and surgery.
Always. Standard care plus HBO. Never HBO alone for these conditions.
Okay. Let's dive deeper into some of these. Soft tissue infections, you said, often necrotizing. It sounds bad.
They can be incredibly serious. Rapid tissue death, often in patients who are already compromised diabetes, poor circulation, maybe after trauma or surgery.
What makes them happen?
Usually a combination of factors. Low oxygen in the tissues, contamination, tissue damage, sometimes the wrong initial antibiotics.
And the approach is aggressive.
Has to be. A multi-pronged attack. Broad-spectrum antibiotics. Very early and thorough surgical debridement, getting rid of all that dead tissue, plus intensive HBO therapy.
And prevention is key too, I imagine.
Absolutely. Studies looking at outcomes identify risks like age, how far the infection is spread, and critically, delays in getting that surgical debridement.
Interestingly, diabetes wasn't a direct risk factor for death.
Not on its own, according to one study, unless combined with kidney problems or significant vascular disease.
And does HBO offer a particular edge in these infections?
It seems to, yes. Several reports suggest HBO helps achieve earlier wound closure. It's a huge benefit, shorter hospital stays, maybe less need for complex skin grafts later.
Can you give examples of these soft tissue infections?
Sure. There's crepitant anaerobic cellulitis, often in the legs after trauma, involves gas-producing anaerobes. Then progressive bacterial gangrene, a slower, ulcerating infection, often synergistic mix of bugs. HBO is for the severe cases there.
And necrotizing fasciitis, what you mentioned, the intense pain.
Yes, the pain is often way out of proportion to how the skin looks initially. That's a red flag. It's rare but spreads incredibly fast. Can be strep or polymicrobial.
And HBO helps with mortality.
A key Australian study showed significantly lower mortality in NF patients who got HBO, about 12% versus 24% without it, even after adjusting for how sick they were. That's compelling.
Definitely. What about non-clostridial myonecrosis? Sounds like gas gangrene, but different bacteria.
Similar in that it destroys muscle and fascia. Fournier's gangrene is a well-known type, a localized, very aggressive NF affecting the genital area, often linked to urinary or bowel issues.
And HBO is used there too.
Yes, as an important adjunct. Studies suggest it significantly reduces mortality, and there were even case reports where HBO seemed to halt the infection spread when surgery and antibiotics alone weren't enough.
Okay, let's focus on gas gangrene itself now. That sounds like one of the classic, most severe uses for HBO.
It really is a terrifyingly acute, painful necrotic infection caused by those gas-forming anaerobes, mostly Clostridium perfringens.
And they thrive in low oxygen.
Exactly. Trauma, poor blood supply creates the perfect environment. Then they release potent exotoxins like alpha toxin.
Oh, what does that do?
Causes massive tissue swelling, which further crushes blood vessels, reducing oxygen even more, allowing the infection to spread like wildfire. It's a truly vicious cycle.
What puts someone at risk?
Major trauma, deep wounds with foreign bodies, gunshot wounds, compound fractures, soil contamination, delays in surgery, poor circulation, anything that creates that low oxygen damaged tissue state.
And the signs are pretty dramatic.
Very. Rapid swelling, skin discoloration, bronze, gray, purple, maybe blisters or watery discharge. The pain is usually severe and early. Crepitus, that crackling gas under the skin, comes a bit later but is a classic sign. Patients get systemically very sick very fast.
How does HBO fit into the treatment plan, the Amsterdam regimen?
Right. That protocol stresses immediate penicillin, surgical inspection, and then rapid HBO, usually 2.5 to 3 ATA for 90 minutes.
How often?
Frequently at first, maybe 3 or 4 times in the first 48 hours, then tapering to twice daily as they improve.
And what's the HBO actually doing in gas gangrene?
A few crucial things. One, the high oxygen creates those free radicals we talked about. Clostridium species lack the enzymes to deal with them effectively, so they're very vulnerable.
Okay.
Two, crucially, HBO inhibits the production of that nasty alpha toxin once tissue oxygen gets above about 60 mmHg.
Stopping the toxin factory.
Exactly.
Yeah.
And three, it directly fights the hypoxia that the bacteria need. But, and this is vital, HBO won't work well if there's still dead necrotic tissue present.
Why not?
Because that dead tissue contains catalase, an enzyme that breaks down the very free radicals HBO generates. You must have aggressive surgical removal of all non-viable tissue first. You need tissue oxygen up around 250 mmHg to really stop the Clostridia growing.
So surgery is absolutely paramount.
Non-negotiable. HBO can then help demarcate the line between living and dead tissue for subsequent surgeries, and it boosts oxygen in the surrounding healthy tissue, helping to contain the spread.
Is the evidence strong?
It's hard to do randomized controlled trials for something this acute and dangerous, but there are many, many case series and reports showing significantly improved outcomes, reduced amputations, and lower mortality when HBO is added. The consensus is strong. Early diagnosis, aggressive surgery, and prompt transfer to a center with HBO are key.
And good wound care for prevention, of course.
Absolutely.
Okay, that gives a really clear picture for these severe bacterial infections. What about fungi? Does HBO work there too?
It has a role in certain fungal infections, yes, often as an adjunct. For actinomycosis, technically anaerobic bacteria, but often looks fungal. HBO is recommended alongside surgery and antibiotics, partly because the low oxygen common in those lesions hinders treatment.
Makes sense for an anaerobe. What about true fungal infections like mucormycosis? That sounds terrifying.
It is a really devastating, fast-moving fungal disease,
Right.
especially in immunocompromised people. The thinking behind HBO here is improve oxygen delivery, reduce tissue acidosis, which the fungus likes, and maybe have some direct antifungal effect.
Go use with other treatment.
Oh, yes.
Okay.
Always with aggressive surgery and antifungal drugs like amphotericin B, especially in rhinocerebral mucor, affecting the sinuses and brain.
What about common fungi like Candida?
Lab studies in vitro show high oxygen pressure can inhibit or kill Candida. But how well this translates to clinical use in patients and how it interacts with standard antifungals still needs more research. It's not standard practice yet.
Okay. Any others mentioned?
Nocardia, which is actually a bacterium but can cause abscesses, seems to respond well in some cases. And for certain invasive molds, phycomycetes, causing necrotizing fasciitis, sometimes the gas gangrene HBO protocol is tried.
Quite a range. The sources even mention AIDS management. That seems surprising.
Yeah, that's more historical context. Back in the late 80s, there was some early interest.
Why?
The theories were maybe the free radicals could damage the HIV virus itself, maybe boost other antiviral mechanisms, help with the opportunistic infections common in AIDS, or even stimulate the immune system at lower pressures.
But did it pan out against HIV itself?
Not really. The main issue is most HIV isn't freely circulating, it's inside cells. And hitting the virus inside cells without harming the cells is the big challenge. Some early lab results were mixed, not consistently reproduced.
So no direct anti-HIV effect proven.
Not convincingly, no. Where HBO does seem helpful is in treating those secondary opportunistic infections that plague AIDS patients. It can improve their condition, maybe reduce mortality from those infections, but it's not seen as a primary way to eradicate HIV itself compared to modern drugs.
Right. Managing complications rather than the virus. Okay. What about some miscellaneous ones? Leprosy?
Hansen's disease, yeah, interesting history there. Effective chemo exists now, of course. But back in the 1930s, there were reports from Brazil using HBO, sometimes with methylene blue dye, showing improvement.
Really? How long ago?
Yeah. Some later studies also reported benefits, but they often had flaws, small numbers, poor follow-up. An unpublished Indian study in '79 supposedly showed negative biopsies with HBO, but really, no definitive large studies were ever done.
So where does that leave it?
It's mostly a historical curiosity. May be considered in very specific situations, severe anemia, drug resistance, ulcers, pre-surgery, but logistics are a huge barrier in endemic areas.
Okay. What about hospital-acquired nosocomial infections?
Big problem. Often aerobic bugs like Pseudomonas. Animal studies suggest HBO, especially with antibiotics, can reduce mortality from Pseudomonas infections. Suggest maybe a clinical trial in humans could be warranted for certain types.
And TB again.
Just briefly, lab studies show HBO inhibits growth and helps anti-TB drugs. But with good drugs available, clinical interest is low, except maybe, potentially, for those extensively drug-resistant cases where options are scarce.
Okay, let's shift to a really tough area. Osteomyelitis. Bone infections.
Yeah, notoriously difficult to treat. Infection, inflammation, poor blood supply, low oxygen all happening within the bone can be acute, chronic, or refractory, meaning it just won't clear up.
And it's becoming more common.
Sadly, yes. Linked to rising rates of diabetes, vascular disease. Diagnosis needs good imaging and, crucially, getting a bone culture to know what bug you're fighting.
Standard treatment is surgery and antibiotics.
That's the foundation. Surgery to drain pus, remove dead bone, any hardware, improve blood flow, plus long courses of the right antibiotics.
But it doesn't always work.
No. Antibiotic resistance is a growing issue, and recurrence rates can be frustratingly high. Surgery works maybe 70–80% of the time for chronic cases, but that leaves a significant number needing more options. And that's where HBO comes in.
Because the bone environment is hypoxic.
Exactly. Oxygen levels are often well below that 30 mmHg level we talked about, where immune cells struggle. Both the bugs and our own inflammatory cells consume oxygen, and the blood supply is often compromised.
So how does HBO help specifically in bone?
Several ways. It jacks up the oxygen levels, obviously,
Yeah.
helping those white blood cells kill bacteria better. It also promotes angiogenesis, new blood vessel growth into the bone.
Bringing more oxygen and immune cells.
And antibiotics, yes. Plus, it stimulates osteogenesis, bone formation, helping healing. And it might help osteoclasts clear out damaged bone. Interestingly, the main benefit seems to be boosting host factors, not directly killing bugs in the bone. Getting oxygen to around 100 mmHg seems optimal for these effects.
Is there good evidence for this?
Yeah, starting with animal studies back in the 60s showing HBO helped clear staph osteo by boosting defenses. Studies have measured increased oxygen in bone during HBO, though it drops back down afterwards. Animal models show combining HBO and antibiotics gives the best results, though complete sterilization is tough.
And in people.
Clinical studies, especially in chronic refractory osteomyelitis, show pretty good success rates, maybe 60–85% in some series, often using 2 ATA pressure. These are usually patients where amputation was the alternative. It's used for post-traumatic osteo, skull, and spine infections, where surgery is tricky. Though one study did report negative effects, so patient selection matters.
Always as an adjunct, right?
Always, with surgery and antibiotics, it's a supplement, not a replacement.
What about specific locations, jaw or sternum?
Jaw osteo often follows dental issues. The lower jaw, mandible, is more vulnerable due to less blood flow. Standard treatment works for many, but HBO is indicated for refractory cases, especially a form called diffuse sclerosing osteomyelitis. It can help avoid really aggressive surgery.
And the sternum, after heart surgery.
Yes, infected sternal dehiscence. HBO has shown good results there, again combined with surgery, irrigation, antibiotics, usually but higher pressure, maybe 2.8 ATA. One review suggested shorter ICU stays and lower mortality with HBO.
And finally, malignant otitis externa. That ear infection.
Right, nasty Pseudomonas infection invading the temporal bone, usually in older diabetics. High mortality if not treated aggressively. Need CT scans, long-term targeted antibiotics, surgery, and HBO. That multimodal approach really improves survival and quality of life, justifying the effort.
Wow. This has been a really comprehensive deep dive. It's amazing how tweaking oxygen pressure can have such wide-ranging effects on infections.
It really is. The key things to take away are that HBO can be a powerful adjunct by boosting our own immune response.
Right, helping those leukocytes.
Directly inhibiting certain microbes, especially anaerobes, and making antibiotics work better, particularly in those oxygen-starved tissues.
But critically, it's usually not a magic bullet on its own. It's part of a team approach with antibiotics and surgery.
Exactly. It's about integrating it smartly into the overall treatment plan for these complex, difficult infections. The research is ongoing, and the potential is significant.
So, as we wrap up, here's something for you, our listeners, to think about. With antibiotic resistance becoming such a massive global threat, and with complex infections on the rise, how might hyperbaric oxygen therapy become a more standard, more accessible tool in our fight against microbes in the future?
A critical question indeed.
Thank you for joining us on The Deep Dive.